Hello, hello, hello. Hello, hello, hello. Yes, welcome all of you. Am I visible to all? Am I audible to all? Yes, very good. Varu Thakur. Yes. Okay. So can all of you see me? Can all of you? Good morning, all of you. Yes. Welcome all of you, wishing you all a very happy and a very success. Is the audio video all clear? Can I get thumbs up? Is the audio video all clear? Yes. Wishing you all a very, very happy new year and a successful new year. Thank you NLC channel. Thank you Dr. Ashish sir for inviting me for this MAHA revision, as we call it, for OBGY. Very important session, 2 hours. Stay right till the very end and you're going to get lot of information we are going to discuss. Okay. Quickly subscribe to the YouTube channel also of NLC. And please feel free to answer questions. I want it to be an interactive session, and before we proceed further, please take exactly 10 seconds time and start following me on Insta. Very important real content we are putting every day. And also please quickly follow me on my YouTube channel, so that I put lot of interesting videos, including the recall sessions will be conducted, so where for OBGY, where you'll get all the information. Okay, so just take 10 seconds time and quickly start following me on Insta and on YouTube also. Yeah, PDF also will be uploaded. Beta, the PDF will be immediately after the session is over. Murlidharan, we will be this at the in this Telegram channel also. I'll be posting the PDF also. Okay, yes. So you can this one. Okay, yes. We'll try to put the both unannotated and it also will try to put in. Is it understood to all of you? Yes, Murli. Yes. Let us begin. Let it be like an interactive session. All these questions are the most important, and okay, and this. Okay, so most important topic, sure short. So I have discussed, because we have got two of the most important. Which of the following indicates a primary amenorrhea in the patient? Okay, mother is brought, a girl is brought to the OPD by her mother. What do you think is the new definition of primary amenorrhea? Okay, so first of all, we are going to discuss 3-4 questions, where by the time most students join in, I'm going to put only like a test and discussion, 3 to 4. I want all of you to answer. Right, wrong nahi farak padta hai. I want A, B, C, D, A, B, C, D in the answer. Okay, A, B, C, D. Okay, B, 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 whatever. Okay, right, wrong ka tension mat lo. I want all of you to answer. Okay, I want all of you to answer. Okay. Okay, A, B, C, D, A, B, C, D. Okay, yes, yes, yes. We'll tell the answer in 2 minutes. Okay, picture abhi baki hai mere dost. Next, moving on. The commonest cause of primary amenorrhea is. I'm giving first 4-5 MCQs, then we are going to the answers. Okay. The commonest cause for primary amenorrhea is what? Which? Okay, is it androgen insensitivity? What is another name for androgen insensitivity? Testicular feminization syndrome. Mullerian agenesis, also called as Rokitansky-Meyer-Kirschner-Hauser. Ovarian dysgenesis. What is the other name? Picture abhi baki hai. Okay. Very quickly, one of the very important clinical case scenario. Patient has come to the OPD with primary amenorrhea. I'm going to tell you which are the important buzzwords जो आपको याद रखना है. Breast well developed. Please keep that in mind. Absence of axillary and pubic hair. That's the clincher. And lump is felt in the inguinal area and absent uterus. What do you think is the diagnosis? When you get a long clinical case, students panic and then they get it, then they are panicking. Okay, so don't get afraid of clinical cases. We're going to discuss even the important images also. Okay, okay, very good. A, B, C, D, A, B, C, D. ठीक है, don't worry, answer अभी सब discuss कर रहे हैं, because few students join in by some late. Okay, and very important virgin MCQ. Virgin MCQ. I want the diagnosis. I have got a girl with primary amenorrhea, short stature, shield-shaped chest. What will be the most likely ultrasonography findings? So all these are must-know clinical cases for the exam. Okay, yes, A, B, C, D, A, B, B, B. Very good. Okay, yes, chalo. So, welcome once again. Welcome all of you to our session. Wishing you all a very happy new year, and let us begin. And just an important announcement, OBGY booster course starting on 5th and 6th of January. See you live at 6 p.m. Don't miss out. It's only 249 rupees, and previous students only get it at only 99 rupees only. Okay, yes. So, let us begin our discussion. Now, this is very important. Yes, we're going to discuss the karyotype also. Now, please understand this, that the primary amenorrhea, you should know the new definition. Anybody, do you know what is the new definition of primary amenorrhea? So, first of all, remember that the old criteria was 14 years and 16 years. Okay, now why we have two definitions is, please pay attention, that when I see a girl in the OPD and if secondary sexual characters, that means breast development, axillary pubic hair is present, then I would like to wait. This I call it as SSC, secondary sexual characters. Okay, so but if I see a girl in the OPD and if she is already 14 years of age and there is no secondary sexual characters, there is no breast development, no axillary pubic hair, there is no point waiting, and you label her as primary amenorrhea. But if this secondary sexual characters are present, then I would like to wait till 16 years of age. Very good, Anirudh. Very good, Varu Thakur. This is surely coming in the exam. This old criteria you are not supposed to remember, and the new may 1 year less we have made it. That means this 14 has now become 13 years and 16 has now become 15 years. Is this understood to all of you? So now you see 14 is out. 14 को याद नहीं करना है. Okay, 13-year-old, no menses but with breast development. Wrong. Here we will wait. I will wait. Why we will wait? Because sir, there is breast development. Is this understood to all of you? हाँ मोहम्मद इरफान बेटा इंग्लिश भी बोलेंगे और सिंपल इंग्लिश है बेटा, इतना इंग्लिश सबको आता है. ओके, डोंट वरी, आई एम गोइंग टू गिव वेरी सिंपल इंग्लिश और हिंदी में भी बात करेंगे. डोंट वरी मोहम्मद इरफान. ओके, यस. सो समझ में आ गया. सो बी आंसर नहीं है. बी आंसर क्यों नहीं है? बिकॉज देयर इज विद ब्रेस्ट डेवलपमेंट. सो आई विल वेट. आई वुड लाइक टू वेट टिल at least 15 years. And for 13-year-old, no menses without breast development. C is the answer. Yes, do you agree with me or not? Okay, is this understood to all of you? Is understood to all of you? So C is the answer. So जिन्होंने भी A और B बोला था, wrong, clean bold. C is the answer. 13-year-old girl not yet attended menarche, मतलब no menses but without breast development. B answer क्यों नहीं है? Because in B I would like to wait. And 14-year-old no menses without breast development is the old criteria and therefore it is not the answer. Is this understood to all of you? Clap if you have learned something new. Very good, Dr. Idiopathic. So C is the answer. Very important. एग्जाम के दिन पे मुझे याद करोगे. OG in the chat box. एग्जाम में ये क्वेश्चन आने वाला है. Now, the commonest cause is, yes, Turner syndrome. Turner syndrome, which is the karyotype also we are going to discuss, and that is also called as ovarian dysgenesis, is the most common cause or number one common cause for primary amenorrhea. Is this understood to all of you? But OG Guru students, खाली एक याद नहीं रखना है, second most common cause and third most common cause also याद रखना है. So RMKH is the second most common cause. What happens? All that you are going to discuss that. And androgen insensitivity. Thank you, Varu. Thank you, Thakur. Okay. And this is the third most common cause. Is this understood to all of you? Is this understood to all of you? So androgen insensitivity, testicular fibrillation is the third most common cause. So 3 MCQs get discussed with this. Is it clear? First most common cause Turner's, second most common cause, third most common cause. Clear? Crystal clear? Yes. Now, very important MCQ. एक trick आपको बता देंगे, ध्यान से सुनेंगे all of you, that whenever I get a combination of primary amenorrhea and absent uterus, whenever you get a combination of primary amenorrhea and absent uterus, which you will always get in the exam. You have to think of only two. Only two are the possibilities. Okay, only two are the possibilities. What are two possibilities? Yes, sir. Either it is RMKH or Mullerian agenesis, and second, it is androgen insensitivity syndrome, complete androgen insensitivity. Very good, Jimit Patel. Okay, so please understand this. Don't even look at option 3, option 4. Option 3, option 4 मतलब के बाकी जो भी होगा. See, whatever names they may give you, कोई कभी कभी सिंड्रोम के नाम नहीं सुने होते हैं. कॉकरेन सिंड्रोम, कालमैन सिंड्रोम, ये सिंड्रोम, वो सिंड्रोम, नाम नहीं भी सुना है, डज नॉट मैटर. सर, इन द क्वेश्चन पेपर, लुक ऑन द बोर्ड, we have got these two hints. Can you see the two hints what I'm telling you? Yes, sir. We have got primary amenorrhea and we have got absent uterus. तो ये दो out हो जाता है, not possible. And the further differentiation is what? Yes, sir. In both of them, breast is not a difference. Breast is well developed in both of them. We are supposed to look at axillary and pubic hair. Sir, in RMKH, basically here the androgen receptors are okay. An important clue ये है कि sir, even in female, the axillary and pubic hair is androgen dependent. So sir, here axillary and pubic hair will be well developed, and here axillary and pubic hair will be absent. Okay, so breast is going to be common both में. You are main going to focus this, and also they are going. So what is the answer? Yes, absence of axillary and pubic hair. We are going to mark A as the answer. Is this understood to all of you? Clap if you feel happy. एक अगर चेंज कर दिया, वेरिएशन इन द क्वेश्चन, अगर यहीं पे बता दिया कि एब्सेंस को हटा के प्रेजेंस कर दिया, आंसर चेंज हो गया. इज दिस अंडरस्टूड टू ऑल ऑफ यू? So please keep this in mind. And can anybody tell me, very important, what is this lump in the inguinal area? What is the lump in the inguinal area? Because that is also very important. Sir, RMKH में होता है ovaries. Ovaries are perfectly normal. Ovary are normal, therefore they will secrete estrogen, they will have breast development. And androgens insensitivity में होता है testes. Very good. Yes, beta, you only tell me, what is that mass in the inguinal region? Yes, sir, this is that. It is seen in which? No, it is not seen in both. That mass is the testes, is the undescended testes. Why undescended testes? Because sir, descent of testes is androgen dependent. बात समझ में आ गया? And here basically it is a androgen insensitivity, मतलब निकम्मा testosterone. So testosterone is present, but testosterone cannot act. There's a receptor level problem. So testosterone is present, but testosterone cannot act. Basically, that is your androgen insensitivity syndrome. So this undescended, very good. This lump is felt. Lump is our undescended testes. Is this understood to all of you? So mainly आपको याद रखना, it's lump is given just an extra information. Okay, and of course we are going to discuss the karyotyping also. Now here the most important is, can you tell me Turner's syndrome? Here what is the diagnosis? Yes sir, primary amenorrhea, short stature, shield shaped chest. So what is the diagnosis? So the diagnosis is Turner's syndrome. Is this understood to all of you? Now the biggest mistake बच्चा लोग ये करता है कि all of you, if I tell you true or false, Turner's syndrome, uterus is absent. चलो, if I write true or false, चलो एक और bonus MCQ, true or false? Yes, please understand this, कि Turner syndrome में the uterus is absent. ये this is Yes, uterus is not absent, uterus is present, but basically what happens in Turner syndrome, all of you know, basically streak ovaries. Yes, streak ovaries होता है. So ovaries are replaced, basically ovaries are replaced by fibrous bands. So basically ovaries are not functioning. Ovaries are not functioning. And because ovaries are not functioning, uterus will not grow, because uterus requires estrogen for its growth, and therefore uterus is present, but uterus is चिंटू यूट्रस. कैसे याद रखना है? चिंटू यूट्रस या हाइपोप्लास्टिक यूट्रस या बेसिकली अंडर डेवलप्ड या रूडिमेंट्री. क्लैप. ओके, सो प्लीज रिमेंबर के यूट्रस इज underdeveloped, but yes, it is present. It is Turner syndrome is not absent uterus. You will remember me on the day of the exam. Sure shot. Yes. So यहाँ पे absent uterus normal ovary किस में होता है? चलो tell me which condition I have got absent uterus normal ovaries. Okay, so you don't have absent uterus and streak ovaries. This is out. Absent uterus, undescended testes, I just now told you, it will be seen in androgen insensitivity. Absent uterus, normal ovaries is RMKH. Yes, sir. Isn't it Thokotali? And hypoplastic uterus with streak ovaries. That is the answer. That is the answer. Isn't it all of you? Isn't it all of you? Is it clear to all of you? So absent uterus Turners में नहीं होता है. Absent uterus normal ovary is RMKH. Absent uterus streak ovaries is not possible. Absent uterus undescended testes, you get it in that androgen, and this is the answer for our Turner syndrome. Yes, yes, yes. Match the column. New style. जब ये आता है student panic करते हैं. New style pattern. Go and check my YouTube video also. I have put 2 videos recently about the new pattern MCQ. I'm going to cover that also. आज के lecture में भी वो new pattern आने वाला है. मतलब के multiple correct options हो सकते हैं वैसे वाले. Yes. Is it understood to all of you? So here are the syndromes. Here are the karyotype, and all of you should get this correct. Is this understood to all of you? Turner syndrome, all of you know 45XO. तो 1A already 2 option rule out. RMKH. Yes sir, RMKH is a normal female. XX, so 2C, very good. 2C, yes. And androgen testes है. Testes, all of you I told you, right? Androgen insensitivity में क्या है? Sir, androgen insensitivity में the testes are there, and therefore they have got XY karyotype. XY, जब Y chromosome होता है, then only the testes get formed. Isn't it? Logic basic. So AIS is our 3B. And Klinefelter they teach you in pediatrics 47 XXY4D. Very good. B is the answer. So I love match the columns. The reason being कि आपको एक साथ 4 क्वेश्चन सॉल्व हो गए. Clap. 4 MCQs are there. सेपरेट भी आ सकता है. टर्नर्स XO है, AIS इज XY, लड़का है वो, ठीक है. RMKH इज XX, एंड दैट इज वेरी वेरी इंपॉर्टेंट. सो प्राइमरी एब्सेंट यूट्रस, ये शॉर्ट टॉपिक है, याद रखना ही है. इमेज बेस्ड क्वेश्चन, आज के सेशन में भी हम इमेजेस डिस्कस करेंगे, एंड बहुत सारा इमेजेस कंप्लीट IBQ सेशन के लिए डाउनलोड द OG Guru ऐप. एंड 5th of January evening 6 PM live I am coming in the app, and all of you please enroll. It's just 249 rupees, just the platform. We have taken 2 6-hour session. 3 hours we are going to discuss images, 3 hours all the clinical cases of obs and gynae. Don't miss out. अब सब लोग आप मिलेंगे मुझे Monday and Tuesday live at 6 o'clock in the app, OG Guru app. Yes, very good. तो ये प्रोसीजर क्या है? This procedure, what is this procedure? Sir, uterus है, baby है, and inside the uterus we are poking a needle. Zoom करके थोड़ा बता देंगे, and you can see the needle should not touch the baby. हाँ, baby को poke नहीं मारना है. तो needle is in the Leica pocket, and we are sucking out the liquor. Very good. This is amniocentesis, and for the purpose of trisomy 21 detection, very good, normally we do it at 16 to 18 weeks is what we do it, and 15 to 18 is the answer. We don't do it in the first trimester, kabhi bhi nahi karte hain. And can you tell me one more indication of amniocentesis? एक amniocentesis is to get the karyotyping purpose. Okay, for trisomy 21 matlab for karyotype, because you want to detect the baby. Okay, yes, karyotyping के लिए. Okay, now also tell me, when do I do, one more bonus MCQ, when do I do amniocentesis in the third trimester? Okay, any idea? एक indicate, there is one indication, actually two indication of doing amniocentesis in the third trimester, in case if you get an MCQ, virgin MCQ. Chalo. Yes, very good. Shivani Gupta, Murlidhar, Anirudh, all of you, sir, when there is severe polyhydramnios and maternal distress, mother is having breathing difficulty, then also like how you do ascitic tapping, we can take the liquid, we can poke in the needle and remove some of this. Okay, so severe polyhydramnios, also severe polyhydramnios, also perfectly correct. Severe polyhydramnios, which is causing maternal breathing issue, maternal distress. Okay, maternal distress jab ho raha hai, yes. Okay, no, beta, that is no, that could be even 32 weeks, 34 weeks, 36 weeks, anytime. Okay, matlab bahut severe hai, 32, 33, 34, that time we do amnio in the third trimester also. Okay, and by the way, also for RH iso immunization also, when we also, that is very difficult, but for RH iso immunization also we can do amniocentesis also in RH iso immunization, when the RH antibodies are present for fetal hydrops to decide what is the fetal anemia. Okay, but this was an invasive method. Okay, to find out about the Lilly's chart and all that is different. वो छोड़ दो, but खाली ये भी याद रखोगे तो बहुत हो गया. Is this understood to all of you? So sir, this is a process of amniocentesis and karyotyping के लिए 15 to 18 weeks, 15 to 20 basically anytime after 14 weeks. Okay, 14 weeks. Chalo, and one more MCQ, can you tell me when do we do chorionic villus sampling? Chorionic villus sampling कब करते हैं? Chorionic villus sampling, when do I do? So chorionic villus sampling is done in the first trimester and 10 completed weeks. Okay, 10 completed weeks, never before 10. Please comment in the chat box kya hoga if you do chorionic villus sampling at around 8-9 weeks. Okay, so 11 to 13 weeks is the time, which is the best time to do chorionic villus sampling for fetal karyotyping. Is this understood to all of you? Yes. Now, very important PYQ, sure shortcoming. Chalo, tell me. All of you know, okay, sir, the MTP was allowed till 20 weeks of gestation, but now we can do MTP up to 24 weeks. 24 weeks. For what indications? Chalo, tell me. Very good, Shivan. Limb hypoplasia. Yes, limb reduction defects. Very good. No, so don't say 10. 11 to 13 is better. Okay. And Anura Umang. Okay. Umang 6 are 10 to 13. Avoid saying 10. Okay. Because 10 completed week. So 11 is better. Very good, very good. तो ये जब क्वेश्चन आया, very good, when this question came directly, 22 weeks, चलो, can be done. Wrong, clean bold. What is wrong? Yes sir, please understand this, that this 20 to 24 weeks limit, 24 weeks is for what indication? Yes sir, if there is any fetal anomaly in the baby, like we detect sometimes anomaly in the baby at 20 to 23 weeks, or any genetic problem in the baby, Down syndrome, okay. So any structural anomaly in the baby, or any genetic problem in the baby, or if it is sexual assault victims and rape, and these are the indications where we can do up to 24 weeks, of course to save the mother's life also. Okay, and some special conditions are mentioned, like change of marital status, divorce during pregnancy or couple undergoes divorce at 21-22 weeks, वो आप सब नहीं याद रखोगे तो भी चलेगा, but mainly for sexual assault victim and anomaly in the baby, chromosomal or genetic problem in the baby. Very good. Most importantly ये है कि sir, for failure of contraception, surely this question is coming. For failure of contraception, okay, failure of contraception, MTP is still only up to 20 weeks of gestation. Is this understood to all of you? If your condom has ruptured or burst or occiput failure, you can't be sitting at home till 24 weeks. Is this understood to all of you? So please understand this. Here it is occiput failure, so it is failure of contraception. It is failure of contraception and therefore 22 weeks, sorry sir, can be done. Nahi hai after permission, all that, no, yes, but sir, by chance if I do sonography, very good, and if there is anomaly in the fetus, then yes, we can do it. Is this understood to all of you? So can be done if there is anomaly detected, otherwise no. Even if two doctors opine no, it is not, because it is 22 weeks failure of contraception. Very important. OG in the chat box hearts. Okay, ये short question आने वाला है. Very very important topic. 2 questions. चलो, diagnosis first. Clinical case. Obesity, acne, hirsutism, infertility. What do you irregular periods? What do you think is our diagnosis? Diagnosis क्या है? And which criteria? Yes sir, this is PCOS, most likely clinical diagnosis based on your acne, hirsutism, infertility, irregular periods also, and we use Rotterdam criteria. Rotterdam criteria we use. Please keep this in mind. What do you think is the answer? The treatment of choice. I want the answer. Yes, Rotterdam criteria, PCOS. Very good, all of you. Answer बताएंगे. Answer. अनिरुद्ध, क्लीन बोल्ड. ओके, ध्यान से सुनेंगे. शी वॉन्ट्स ट्रीटमेंट फॉर इनफर्टिलिटी. शी वॉन्ट्स ट्रीटमेंट फॉर इनफर्टिलिटी. इनफर्टिलिटी पेशेंट को ओसिपिल. रॉन्ग. खुर्शीद, रॉन्ग कॉन्सेप्ट. अभी सुनना मेरा. और ओसिपिल कब देना है बताते हैं आपको. ओके, इज दिस अंडरस्टूड टू ऑल ऑफ यू? एंड पिक्चर अभी बाकी है. नाउ दिस क्वेश्चन, चलो ये वाला आंसर क्या है? Yes, ये वाला आंसर क्या है? Again we have got the patient who is obesity, acne, hirsutism, testosterone levels are elevated, and you can see the ratio also. What is the ratio? Okay, is this understood? यहाँ पे भी married lady for 3 years, लेकिन what is the difference in the question? Okay, so first of all please pay attention that normally, okay, FSH to LH ratio 2:1 is considered normal. Okay, but in PCOS the ratio will become inverted. It could be 1:2, 1:3, or even 1:4 in patients of PCOS. Okay, this ratio, and that is it. It could be this or this also, and that is over here हमको दिया है 9/36, so which is 1:4. So LH is on the higher side. Yes, so please understand this कि एक तो रोटरडम क्राइटेरिया याद रखना है, and please understand this lifelong remember कि sir PCOS का the treatment will depend on what the patient wants. If the patient is having infertility or planning pregnancy, she tells you that doctor, I want pregnancy or I am having infertility. One word answer. Very good, Jimit. Okay, one word answer. Why is there infertility? And ovulation, and therefore when there is infertility, I have to go for ovulation induction. And over here, remember, clomiphene citrate, wrong. Clomiphene citrate was the drug of choice. Okay, clomiphene citrate was the drug of choice in PCOS. Nowadays, letrozole is giving better result, and therefore letrozole is the first drug of choice. I am not saying you don't give clomiphene. Of course, clomiphene citrate can be given. Second choice है. ये सब काम नहीं किया, then I have to go with injections. Recombinant FSH या HMG, human menopausal gonadotropin. No, it's not obsolete beta. Okay, it's not obsolete. Clomiphene is still given. Clomiphene दे सकते हैं, but as a second preference. Is this understood to all of you? And therefore here I will not give OC pills. HMG is human menopausal gonadotropin is last option. Last में देते हैं when there is failure of A and B. Okay, so answer is letrozole. And of course all of you know HMG is human menopausal gonadotropin from the urine of the postmenopausal lady. And all of you know that sir, in PCOS there is going to be insulin resistance, and therefore of course ये बहुत important question है कि lifestyle changes. Yes, lifestyle modification, diet, weight loss, exercise, ये तो करना ही है. And what else can I do? Lifestyle changes compulsory, diet, exercise, and metformin. Very good. Metformin also is a insulin sensitizer. So this also you have to give. Metformin can be given to all, but so here the patient wants infertility. Is this clear? So when she says infertility, you are not going to give her OC pills. Clear? But now second patient also, यहाँ पे देखिए क्या ट्रिक है कि here also married बोला है, married since 3 years. So sir, is she infertile? No. Yes, could be, could not be. But look at the first line. What is the first line? Sir, she comes for treatment of hirsutism. So when she comes for treatment of hirsutism, no point giving clomiphene, no point giving letrozole. And ovarian drilling is almost outdated, kachra, dustbin. Abhi nahi karte hain ovarian drilling almost. Okay. It is only when all the methods for ovulation induction fail, only for pregnant lady, only for patients planning pregnancy, infertile patients we can think as a last resort. Okay, and therefore clap if you feel happy to come back to the flow chart. And patient says, okay, sir, I don't want pregnancy planning. Okay, so the patient is having infertility or planning pregnancy, एक जगह जाना है. And patient says, doctor, I don't want pregnancy, but please give me treatment for irregular periods, and also give me treatment for acne and hirsutism. तो क्या करना है? नाम में ही आंसर है. क्लैप इफ यू फील हैप्पी. नोबडी विल टीच यू लाइक दिस. PCO उल्टा कर देंगे OCP. ठोको ताली. They are made for each other. PCO, OCP, made for each other. एक ही गोली. Yes. And therefore here, sir, we prefer to give OC pills because they have got anti-androgenic property, and they will also regularize the cycles. And therefore here, sir, let her be married for 3 years. They have told that she wants treatment for hirsutism. So most appropriate treatment for her condition is OC pills. Clap, ठोको ताली. क्या याद रखना है? PCO उल्टा कर देंगे OCP. PCO, OCP. Okay. Clear? And of course, do not forget your lifestyle changes, diet, exercise, weight loss. This is considered the first line or always the initial management. Okay. First line treatment. Yeah, if they tell you initial management, always you have to tell the patient about this diet, weight loss, exercise, metformin to be added. Is this understood to all of you? Insulin sensitizer. So this MCQ answer is letrozole, not clomiphene and not OC pills. And this MCQ answer is OC pills and not this other drug. Clap if you have learned something new. Okay. Screening test for second trimester for aneuploidy, matlab again trisomy 21. Very important. Screening test bola hai except. So can you tell me FSH-LH ratio inversion indicates again a patient of PCOS, but not compulsory, not necessary. It's not necessary for the diet. It's not a part of the Rotterdam criteria, FSH-LH. Okay. Is it clear to all of you? Yes. So what is the screening test used in the second trimester? Very good. Sir, in the second trimester, sir, we use either a triple marker test or a quadruple marker test. And triple marker test, HCG, alpha fetoprotein, and what? And what? Unconjugated estriol ke estradiol. Anybody? Unconjugated estriol, not estradiol. HCG is higher than normal and other two are lower than normal. And quadruple marker test mein we add inhibin A to be precise. Okay, inhibin is added, which is also higher than normal. Okay, and both these are done in the, either you do triple second trimester. ये भी याद रखना है, short question, generally done between 16 to 18 weeks. So the answer over here, yes sir, PAP-A, sir, PAP-A, pregnancy associated plasma protein, a very important, it is a part of dual marker test, and dual marker test, sir, is done in the first trimester. Is this understood to all of you? Dual marker test is done in the first trimester. Okay, when again 11 to 13 weeks. Yes, anything H, yes, correct. So you can also remember HCG will be higher, AF will lower, inhibin is also higher. PAP-A, by the way, is going to be lesser than normal. Okay, PAP-A values are going to decrease. Okay, we're going to discuss, वो भी एक आएगा question. Yes, very important. Again ये question आएगा exam में. Nulliparous patient, third degree prolapse, what is the treatment of choice? Harish Swami, no, not only PAP-A. You do what in dual marker test? You do two things. In dual marker test, we do HCG plus PAP-A. Okay, HCG and PAP-A, that is dual marker test. So yes, HCG is done in both. HCG is not the answer because it is done in second trimester. It is done in first. So HCG is done in both T1 and T2, and therefore PAP-A is the best answer to mark because PAP-A is clearly done only in the first trimester. Yes. Now those, यहाँ पे किसने मार्क किया है हिस्टेरेक्टमी? ओके, हिस्टेरेक्टमी किसको करना है? You have to put them in jail. जेल में डालो. जेल मतलब सजा. Why सजा? Because sir, if in a 24-year-old lady आपने यूट्रस निकाल दिया, हम आपको जेल में डालेंगे. Is this understood to all of you? Will put you in jail. Why jail? Because sir, in a 24-year-old patient, if you remove the uterus, that's a crime. Absolutely, it is wrong. Similarly, Leaford surgery is also again going to get you in jail because it is only for postmenopausal lady. Forget that. If you don't know that, वो सब कहाँ पे है? Only for postmenopausal lady when they are not fit for surgery. And I have got two options: Fothergill and sling surgery. But Fothergill will be avoided at all cost. Why Fothergill you will avoid? Because ये भी हम आज ही discuss करेंगे. There is a MCQ. Don't worry, I will tell you at that time. Because sir, can you tell me what happens in Fothergill? Sir, in Fothergill operation, we do cervical amputation. This is the uterus, this is the cervix. We chop off the cervix. And in Fothergill, cervical amputation is done. And since cervical amputation is done, the cervix can become too tight. There could be cervical stenosis and infertility. And other more important danger is what? Yes, sir, it will cause cervical incompetence. Cervical incompetence, which will lead to repeated abortions in the second trimester. Is this understood to all of you? Repeated second trimester abortions or miscarriage. Is this understood to all of you? Okay, and therefore Fothergill will also be avoided specifically when she is a nulliparous patient. And याद क्या रखना है? Yes, अक्षय कुमार मूवी 10 साल पहले 12 साल पहले Sing is King, and Sing is King was the movie. Yes or no? अभी मत देखना, एग्जाम अच्छा मूवी था, एग्जाम के बाद देख लेना. Okay, so Sing is King, and yes, Sing is also King, and Sling is King. Sling is King is what you remember. Clap. Sling is king. And that sling is king matlab sling is the best. And another name, no, it's okay, another name, abdominal sling surgery. If that is not in the option, another name is cervicopexy. Okay, cervicopexy is the same name as sling surgery. Okay, is understood to all of you? Fothergill is again only in the young. So Fothergill is almost never done. Okay, Harish Swami, Fothergill is almost never done nowadays. Okay, because it can lead to complications. So we always prefer sling surgery. Completed family also, then also we prefer sling surgery only. If this completed family and if they tell you excessive cervical elongation, that is the only time when you do Fothergill. Fothergill ke liye family complete. Okay, family complete plus if there is a excessive cervical elongation. Okay, excessive cervical, too much of cervical elongation, then you can think over there also sling is still better only. Sling is king, sling is the best. Okay, and you will always get question of a unmarried girl or married girl who is not pregnant or planning pregnancy nulliparous. Is it clear to all of you? Is it clear to all of you? Yes. Now when this kind of question comes, student directly start marking. नहीं, ये आपके option नहीं है. Option starts from here. Consider the statement regarding uterine leiomyoma or fibroid. Which of the above statements are correct? Is this understood to all of you? So yes, prevalence is highest between 35 to 45 years of age. You all know 35, 40 plus. Yes, there are always, okay, those who have late marriage, delayed marriage, जो babies नहीं रखते हैं. Okay, because doctor, having a baby is a big headache and responsibility. जिंदगी ना मिलेगी दोबारा. Okay, बच्चे देखेंगे अगले जन्म में. Okay, so those who don't want babies, okay, those who are nulliparous, more common. And yes, when you give GnRH analogs, they are going to shrink in size reversibly. थोड़ा छोटा होता है. And all fibroids do not require treatment. Very important. All fibroids, all of you please pay attention. Suppose there is just, this is the uterus and there is a chin to 1-2 centimeter fibroid, कुछ treatment नहीं करना है. Is this understood to all of you? So if you know, yes, very good. All are correct. 1, 2, 3 and 4 all correct. Okay, all are correct. Okay, all fibroids do not require treatment. Perfectly correct. All statements are correct. Is it clear to all of you? Yes, ये भी this was kind of a question of PYQ और ऐसे questions आने ही वाले हैं. Okay, this is definitely a PYQ. Whether it was with NEET PG or FMG, I'm not able to recollect, but yes, this kind of pattern is coming. Okay, is it clear to all of you? Yes. So all are correct, and this is what it is. So 1, 2, 3, and 4, multiple correct options. Okay. Yes, moving on again this. Yes, so see again ये type of question. So now I have got indications and prerequisite for ventus. Ventus का दूसरा नाम क्या है? vacuum delivery. So vacuum delivery, when do I do? All of you pay attention. Or instrumental delivery is when first of all it is prolonged second stage. Mother is pushing and still the delivery is not, she's fully dilated for 2-3 hours, prolonged second stage. Or when I want to cut short second stage? Anybody, which condition I want to cut short second stage? Okay, sir, heart disease patient, I don't want the mother to bear down, or there is maternal exhaustion, mother is exhausted, or finally there is at full dilatation, the baby heart rate is going down, fetal distress also, fetal distress, ये main आपके indications है. Remember, most important, can you tell me, can I apply it in CPD? If there is cephalopelvic disproportion, is it also an indication? Chalo, tell me in the question paper. Yeah. Okay. No. Sir, CPD को mark नहीं करना है. Remember, when I apply all this instrumentation, the pelvis has to be adequate. Pelvis has to be adequate. There should be no CPD. Okay. And one more important point. Very good. One more important point. This is for forceps and vacuum both. And prematurity is a absolute contraindication. Prematurity is the absolute contraindication for vacuum. Okay, because preterm babies are more prone to intraventricular hemorrhage, and in prematurity, if you apply vacuum, that is going to cause more intraventricular hemorrhage. It will cause increase in intraventricular hemorrhage, and therefore when there is delay in the second stage, very good. Non-reassuring heart disease, very good. And yes, वर्टेक्स ही होना चाहिए. कॉमन सेंस है. बेबी का फेस होगा, फेस पे वैक्यूम लगाएंगे, आई बॉल्स बाहर आ जाएगा, आई बॉल्स विल पॉप आउट. बम पे नहीं लगा सकते. सो वी फॉर वैक्यूम, वी फॉर वर्टेक्स, ठोको ताली, वी. तो ये भी yes. 3, gestational age less than 34 weeks, I will not, it is a indication, no, it is a contra. So 3 is out, 3 is out. जहाँ पे भी 3 है, it is out, and therefore the answer is 1, 2 and 4. Clap. Yeah, depends on the fetal heart rate also, of course, fetal distress also. Yes, correct. Fetal distress is detected on fetal heart rate only, correct. Okay, is it understood to all of you? Yes. Is this clear? समझ में आ गया बात आपको? So vacuum के लिए एक तो vertex होना चाहिए, and prematurity is absolute contraindication because it lead to increased episodes of intraventricular hemorrhage. So this is okay, this is okay, 1, 2, 4 is okay, and that is our answer. EOG in the chat box. Is it clear to all of you? Yes. Again, like a quick revision, आप सबको पता है क्या है? Not true, not true. Yes sir, PAP A, I told you, is going to be lesser than normal. Alpha fetoprotein also is lesser, and anti-scan, I told you, in babies of Down syndrome trisomy, NT is going to be more. Yes, somebody also said in the chat of vertex में, yes, you can apply vertex. Yes, vertex has to be there. vertex में लगा सकते हैं मेडिको. yes, vertex में हम वैक्यूम और फोर्सेप्स दोनों लगा सकते हैं. Okay, yes, so the answer ये भी है, NT is going to be more. HCG is not going to be lesser than normal, whether it's dual marker, triple marker or quadruple marker. HCG is going to be higher than normal, simple MCQ है, do not make a mistake, you are going to get it all correct. Yes. Picture abhi baki hai mere dost, and all of you quickly take 10 seconds to download the OG Guru app and abhi ka bhi join karo. 6 hours live classes. Imagine if this 40, abhi tak to khali 45-50 minutes हुआ. Picture abhi baki hai, lecture over नहीं हुआ है. Okay, अभी और पढ़ाना है आप लोगों को, और MCQs है. लेकिन imagine अगर ये 2 घंटे का सेशन आपको इतना बेनिफिट कर रहा है, 6 hours हम आपको देने वाले हैं ऐप के ऊपर, 3 hours all image based questions of obstetric, gynec, instruments, everything A to Z, and 3 hours of all the clinical case scenarios, all the obstetric, gynec, all the topic, and only the platform fee I'm charging 249 rupees for all of you, and to come and join on 5th and 6th January. So don't miss out. 5th January को OG Guru app के अंदर 6 PM आप सब लोग मुझे मिलने वाले हैं, and I am going to take you on a beautiful ride where you are going to get maximum boost up score, OBG booster score, अगर अभी आपका स्कोर OBGY में 15, 18, 20 है या 15 है, वो जंप अप होकर 25 हो जाएगा एंड 10 मार्क्स मोर, आई एम श्योर इज गोइंग टू हेल्प यू थ्रू, बिकॉज बहुत सारे स्टूडेंट्स गेट स्टक अप एट 140, 145. OBGY is the single most important subject. 30 to 35 questions are going to come. So quickly download the OG Guru app and just in 249 enroll. Many of you have already joined. Reviews and all that I don't need to show you. You can read it aram se for all of you. Very common. So student was stuck up at 140 and then sir thanks to you we are able to cross 150. ऑब्स गाइनी ने बचा लिया, एग्जाम में सेम थिंग होगा आपके साथ. यस, अर्लीएस्ट डायग्नोसिस. नाउ द इंपॉर्टेंट पार्ट इज लाइव प्रेगनेंसी. बेबी जिंदा है, टाइगर पठान जिंदा है, टाइगर जिंदा है, टाइगर जिंदा है. हाउ विल यू कम टू नो? यस सर, फॉर लाइव प्रेगनेंसी we have to demonstrate the fetal cardiac activity, and many of the students directly mark beta HCG या UPT. wrong 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 wrong. Why? Because sir, beta HCG and urine pregnancy test वो जो हम किट में डालते हैं, ओके. यूपीटी क्या है? यूपीटी यस ऐसा फोटो आता है, ओके. 2 बूंद, आप 2 बूंद डालते हो, 2 बूंद खुशी के, 2 बूंद जवानी के, फिर आता है रिपोर्ट कभी खुशी कभी गम. वाई कभी खुशी कभी गम? बिकॉज सर प्लान्ड प्रेगनेंसी है तो खुशी, अनप्लान्ड प्रेगनेंसी है तो टेंशन और प्रेशर. सो यूरिन pregnancy test is detecting urinary HCG, but beta HCG, they will only detect pregnancy. Serum HCG is the earliest to detect pregnancy. Crystal clear to all of you. For pregnancy diagnosis, serum beta HCG is earliest. But for live pregnancy, yes, we need to do transvaginal sonography, because sir, you will see the uterus and inside the uterus you see the gestational sac and then the fetal pole, and inside the fetal pole the baby heartbeat flickering, thuk 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 thuk. Fetal cardiac activity. Fetal cardiac activity, when do you get it? So that is the answer. Fetal cardiac activity can be demonstrated at 6 weeks of gestation, okay. And in newer machine, more powerful machines, even thoda sa early, 5 weeks 5 days, 5 weeks 5 days, yeah, 6 weeks of gestation is when you detect the baby heartbeat. Is this understood to all of you? And this is on transvaginal sonography, on transvaginal sonography. Clap. Okay, transabdominal 1 week later. Transabdominal बाद में. Transabdominal is after 1 week. After 1 week of transvaginal scan, okay, 1 week later. So for live pregnancy, I have to do transvaginal sonography on. Okay, very short question. ये क्या है item? ये क्या है? ये क्या दिखाया आपको? Four weeks you can't detect, na, but heartbeat 4 weeks you can't. It's wrong. 4 weeks you can't get the live pregnancy. 4 weeks pe you can't even get sonography pe anything. Gestational sac comes only at 4 weeks 5 days. Yes. What is this? Chalo. Very good. So this is completely white. It is not a copper T. In copper T here you get a copper wire. You get a copper wire. Okay. तो ये copper T नहीं है. This is a pure hormonal cylinder. Very good. It is LNG, intrauterine device, also called as Mirena. Mirena is the brand name, but LNG, intrauterine device. Now the mistake is, what is the total quantity? Yes, why B is not the answer? Because totally it contains 52 milligrams. And how much LNG is released per day? I also called it as LNG 20. LNG 20 ना, तो फिर 20 ये वाला B वाला आंसर क्यों नहीं है? Why is B not the answer? Yes, because sir 20 microgram is released per day. Okay, so variation in the question, keep that in mind. 20 microgram is released per day. It is basically going to make the period scanty, very helpful. It does not allow the lining to grow. So I can use it in patients of menorrhagia, dysmenorrhea, endometriosis. So 20 milligram, very good. 20 milligram nahi hai, and 20 total. यहाँ पे question है कि what is the total quantity? Total. Okay. If they ask you how much is released per day, then 20 microgram is released per day. Okay. Yes. Very good. Is this understood? Yes. NT scan अभी आपको बताया up to 3 millimeter is considered normal. Okay, up to 3 या 3.5. Okay, 3 to 3.5 is considered normal millimeter, and when NT is more, that is a marker for up to 3 millimeter, or some say 3.5 is considered normal. Yes, increase in NT is suggestive of trisomy 21. This is the scan, very good, done at 11 to 13 weeks of gestation. Is this understood to all of you? 11 to 13 weeks of gestation. Yes. Now can anybody tell me, bonus MCQ, which is the sonography done at 18 to 20 weeks? 18 to 20 weeks. And NT के साथ और क्या करते हैं? एक तो हो गया NT scan. So this is called as NT scan, and nowadays we call it as NBNT scan. Why I call it NBNT scan? NB say nasal bone. Okay, nasal bone, because absent nasal bone. Okay, absent nasal bone. Yes. No, second dating scan नहीं बेटा मुरली, उससे भी important. 18 dating scan गया first trimester. What is most important at 18 to 20 weeks? What are we interested in? Yes. No, Doppler क्यों बात? Doppler is for what? Yes. Okay. Anomaly scan or the malformation scan, the single most important sonography of the whole pregnancy. Malformation scan. Is it clear to all of you? Because all anomalies are not seen at 11 weeks. 11 weeks पे हमको खाली NT measurement होता है. The single most important sonography, where in 18 to 20 you can see baby ka heart, lung, liver, kidney, all that. Yes, very good. Okay, very good, Varu Thakur, very good. Okay, so anomaly scan, also called as malformation scan, is always done between 18 to 20 weeks. Very good. Okay, it's a single most important scan of the whole pregnancy. Virgin MCQ याद रखना है, mistake नहीं करना है. Yes, very good. Yes, Umang and all of you. Yes, very important. PYQ, surely coming. Septate uterus. Yes. So please understand this. Here you should know the important part कि septum कहाँ पे है. Yes, very good. So septum is a condition कि septum projects within the cavity. This is the uterus, and so septum is going to be like this. This is going to be the septum. Is this understood to all of you? Septum is projecting within the cavity of the uterus. Is this understood to all of you? Septum ऐसे project करता है, and that can cause infertility, repeated pregnancy losses, all that. Okay, just a second, all of you. Yeah. Yes. Okay, so no point doing a laparoscopy. Laparoscopy has got no role over here. Anybody, laparoscopy we use for what? Sir, here I want to do something which is causing a problem in the cavity. हमको cavity का problem solve करना है, and therefore hysteroscopy is what we do. Is this understood to all of you? And therefore through the hysteroscopy, septoplasty या septal resection, okay, but always through the hysteroscopy route. Is this understood to all of you? We will go inside the uterus, very good, and we will cut the septum like this. देखो ऐसा 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 we are cutting the septum and making the cavity normal. Is this understood to all of you? So when we have a septate uterus, we have to go through hysteroscopy. Laparoscopy has got no. Laparoscopy is the terrace view. Yes, from the outside the uterus we are seeing. So that is used for endometriosis or for any ovarian, मतलब anything to do with the pelvis, pouch of Douglas, chromoperturbation जो हम करते हैं laparoscopy chromoperturbation. Metroplasty is a same thing. Okay, metro means uterus, so septoplasty or metro same thing. Uterus correction surgery is called metroplasty. Okay, so septoplasty or metroplasty, but it has to be hysteroscopic route. Okay, not laparoscopy. Okay, is it clear to all of you? Yes, very very important. Patient has got 45 days amenorrhea, MTP. Select the protocol. Okay. So please understand this. Again here the total mistake which students make, they are getting confused between MIFI, MISO, all that. Lifelong आपका problem अभी solve कर देंगे. ऐसा होता है कॉम्बी किट, ऐसा होता है कॉम्बी किट, एंड उसमें होते हैं 5 टैबलेट्स, 5 टैबलेट, ये एक और ये 4. ये जो सिंगल टैबलेट है दैट इज व्हाट आई गिव फर्स्ट. ओके, मीफीप्रिस्टोन इज गिवन फर्स्ट. कैसे याद रखना है सर? एफ, क्लैप इफ यू फील हैप्पी. सर एफ में है फर्स्ट, मीफी में भी है फर्स्ट, एफ. Okay, so MIFI is given first. It is 200 milligram single tablet orally. तो यहाँ पे meso is not given first, out. Meso is not given first, out. And why A is not the answer? यहाँ पे unit 200 माइक्रोग्राम नहीं है. Is this understood to all of you? And जो second होता है PGE1 के 4 टैबलेट हैं. Each tablet is 200 microgram. PGE1 mesoprostol, and meso में है S, meso में है S, and therefore second. Is this understood to all of you? Meso is given second drug, okay, after the gap of 48 hours. So day 1, we call it as day 1, day 3. Is this understood to all of you? And therefore mifepristone 200 milligram and misoprostol 800 microgram after 48 hours. C is the answer. Perfectly correct. You can see 200 into 4 hai, so that is 800 microgram. 800 microgram, and that we give it vaginally or orally. All okay. Is this understood to all of you also? Yes. What is this instrument? Anybody? Device least likely to be useful. So please understand this. This is what? This is a uterine sound. To sound the uterus. Okay. Now why do you want to sound the uterus? So sound acts like the first dilator also, and sound will measure the uterocervical length. Is this understood? PYQ. तो यहाँ पे प्लीज अंडरस्टैंड दिस कि द क्वेश्चन इज that sir, whenever I want to do any intrauterine procedures, DNC, suction, evacuation, IUCD, I measure the UCL. Why? Because you want to know the uterocervical length. Because if you put your instrument excessive inside, perforation, rupture. So once you know कि UCL इतना है, you have to be less than the UCL only. So you don't put your instruments excessively. Yes, but the question, all of you wrong. Arnav, Mukesh Kumar, all wrong. This device is least likely to be used in removing of IUCD. Clean bold. Yes, सबके लिए you need to sound. In all this, uterine sound is required. For removing of IUCD कैसे करते हैं? Yes sir, this is the uterus, this is the copper T यहाँ पे होता है and sir यहाँ पे threads होते हैं. Directly you just pull the threads with the artery forceps. You just hold the threads and pull it out. You don't require a sound. For removing IUCD, you don't, sound is not required, isn't it? तो clean bold. So question ध्यान से पढ़ना है. Device least likely or not to be used. Which will not be used, this instrument. Okay, which procedure will not require. Okay. So this was the exact thing. Yes, you just have to pull the threads. Yes, you just have to, removing the IUCD, you just have to pull the threads. उसमें आपको sound का ज़रूरत नहीं है. But for insertion, definitely you have to measure the UCL. Okay, and suction evacuation MTP everywhere you require to use. Okay, you just have to pull the threads out with the artery forceps. Very simple. सबको correct आना चाहिए. ये wrong नहीं हो सकता है. Yes. So, sir, when they have given you history of ovulation induction, what is this? This is ovarian hyperstimulation syndrome. But exam में यही picture दिया था. But along with it, remember basically what it is it's when you give lot of injections, what happens is specifically कब होता है OHSS? Sir, OHSS happens when you give FSH injection or HMG injection, and finally when you give HCG. HCG is the trigger. Okay, but remember that there should also be free fluid. Ascites should also be there in the patient. Okay, so in PCOS, all of you know what is the difference. Yes sir, so PCOS में there are multiple small follicles arranged in the periphery. Periphery में होता है छोटे छोटे follicle. क्या criteria है? Yes, that is your typical necklace of pearl pattern. But in OHSS, all the follicles are big follicles. So big follicles which will be filling up also in the center also. Okay, big follicle center, यहाँ पे small and periphery follicle. Is this understood to all of you? So this is not PCOS, this is OHSS. Yes, necklace of pearls, string of pearls. Okay, all the follicles are going to be 2 to 9 millimeter in size, 12 or more than 12 follicles. Remember this size also. Okay, yes. So as all of you are already aware of it, एक बार पहले बोल देता, एक बार और बोल देंगे. 6th and 5th and 6th of July, please don't miss out 3 hours of image based question, 3 hours of clinical case scenario. Download the OG Guru app and just in 249 rupees platform fee. बहुत बढ़िया सेशन होने वाले हैं and all of you score आपका boost up होने वाला है OBGY के लिए. So don't miss out. Yes, grayish white discharge, positive whiff test. ये short MCQ है. What is this positive whiff test? So what is your diagnosis? Okay, so this is a patient who is having Gardnerella. Yes, bacterial vaginosis. Whiff test क्या है? So we take the secretions and we will add the alkali and you get a fishy odor because of release of amines. Yes, correct. 10% KOH to the secretions and metronidazole. And here in BV में bacterial vaginosis, remember one more thing, it's thought to be because of imbalance between the good and the bad bacteria. So partner treatment not required. Is this understood to all of you? Partner treatment not required. Very, very easy. Okay. Now, again, a tough MCQ. It has come in the past. Patient has had a incomplete abortion or miscarriage. So she may have underwent a curettage and she has come to you with amenorrhea. But FSH is 5. What is the most probable diagnosis of this amenorrhea? Very difficult clinical case. तो यहाँ पे no, we use metronidazole only. That's what I told. Metronidazole drug of choice for this. Okay. Yes. So what is this? So now please understand this. Master, now first tell me, this FSH5, is it less normal or high? Sir, this FSH5 is normal. ये याद रखना है. So please keep this in mind, all of you. Yes. Please keep this in mind कि पहले इफ दे वांट टू गिव यू, ध्यान से सुनेंगे, FSH का याद रखेंगे कि व्हेन दे वांट टू गिव यू normal, okay, so 5 to 10, 5 to 10, 3 to 10 is all considered normal. Okay, is it clear to all of you? Keep that in mind. When the FSH is very, very low, very, very low, which condition? So when there's a master problem, when there is a hypothalamo or the pituitary failure, okay, that means Sheehan syndrome, your postpartum pituitary necrosis or Kalman syndrome, all that, then they will give you FSH very low, like 0.1, 0.2, exam का मैं बता रहा हूँ, basically less than 1 देंगे exam में. Is it clear to all of you? And when they want to say FSH is very high, which condition FSH becomes very high? Yes sir. Sir, when the ovaries stop functioning, when the ovary completely function बंद हो जाता है, master has to shout more loudly कि बाबा काम करो, काम करो. So when they want to give FSH high, they will give you 20, 30, 40 exam में. Is this understood to all of you? Yes. So sir, in ovarian failure, FSH is going to be very, very high. Clap if you feel happy. अगर एक change कर दिया, okay, ये 5 का मैंने FSH बना दिया 45. Now what is the answer? चलो, tell me the answer. FSH 45. Tell me the answer. Okay. एक MCQ पे 3 MCQ बोनस. OG in the chat box. Yes. Okay. Then it is your ovarian failure. Okay. And similarly ये FSH5 का 0.5 बना दिया, FSH 0.5 बना दिया तो आ जाएगा pituitary failure. Clap if you feel happy. Okay. So sir, since FSH is 5, which is normal, this is your intrauterine adhesions, also called as Asherman syndrome. Ovarian failure में FSH is going to be very, very high. Pituitary failure में FSH is going to be very, very low. Clap if you feel happy. So this is very, very important. What will happen in pituitary failure? Beta, all the hormones. Pituitary fail हो गया. So this is a medicine thing. Okay, hypogonadotropic hypogonadism, pituitary failure, Sheehan syndrome or whatever. So the patient will have delayed periods or no periods. Basically all your pituitary failure. Okay, panhypopituitarism. All hormones of pituitary get fired. Okay, so agalactorrhea hota hai. Patient will have failure to lactate. Okay, yes, this is what I have already told you. Fothergill repair is for causing cervical dystocia, yes, preterm labor, yes, and basically Fothergill से होगा cervical incompetence. And cervical incompetence all except first trimester. I told you, you don't get first trimester. Yes, 3 options, 3 different MCQs, superb. Yes, okay. First trimester abortions नहीं होता है. Cervical incompetence always cause abortion in the second trimester, and that also, what is the speciality? Painless abortion. Painless abortion in the second trimester. That is your cervical incompetence. Is this understood to all of you? Okay, so just take 10 seconds time and quickly, all of you, please subscribe to my YouTube channel. Lots of interesting content is there. Go back and see the videos. बहुत सारे important content है. Telegram join कर लेना, ये पूरा PDF वहाँ पे डाल देंगे. And quickly take 10 seconds and follow on Insta. Lots of interesting content and reel Insta पे आ रहा है. If in case you haven't already subscribed, please take 10 seconds and do it right away. Okay, okay, you are going to get lot of important content and information. Okay, for sure. Okay, so that is it. And next question. Okay, again a longish question. Yes, 28-year-old. Chalo, now what is the diagnosis? What is the diagnosis which I want? Okay, suddenly complains of headache, blurring of vision, oliguria, BP दिया है, albumin. What is the next line of treatment or the management? What do you do? Okay, so what is the diagnosis? Okay, yeah, thank. Yes, please understand this. First of all, this is this eclampsia? No, this is not eclampsia because there is no convulsion. Okay, this is impending eclampsia. Impending eclampsia. Why? Because please understand this. Why impending eclampsia ये है? Because please pay attention. There are the not only preeclampsia, wrong. Stranger, Medicopro, preeclampsia better, but can you make your diagnosis better? Of course it is preeclampsia. Of course it is preeclampsia because BP is high, bilirubin plus 4. But this is not only preeclampsia, this is impending eclampsia. कैसे याद रखना है? क्या है निमोनिक? O, B, easy है ना? जब ओजी गुरु, जब मैं हूं ना, ओजी गुरु है तो ओ बी इजी है ना. दैट इज द निमोनिक. ओ से हो गया ओलिग्यूरिया, बी से हो गया ब्लरिंग ऑफ विजन, ई से हो गया एपिगैस्ट्रिक पेन, एच से हो गया हेडेक. ठोको ताली, ठोको. एंड एन इज फॉर nausea and vomiting. Okay, nausea, vomiting. So when these are called as the premonitory symptoms or the dangerous symptoms. Very good, all of you. Excellent. Okay, excellent. Okay, so when these are present, and you can see in our patient, they have given you headache, blurring of vision, oliguria. So whenever you have got impending eclampsia, please understand this, that is the last day of the pregnancy. What is the pregnancy cannot be continued further. जैसे आपने देखा होगा हिंदी पिक्चर में डॉक्टर लेबर वार्ड के बाहर आता है और हम माँ और बच्चे में से किसी एक को बचा सकते हैं. वो सब डायलॉग नहीं मारते हैं, वो सब खाली फिल्मों में होता है. ओके, इन ऑब्स्टेटिक्स मदर इज ऑलवेज फर्स्ट, क्योंकि मदर है, पीछे पूरा क्रिकेट टीम आ सकता है. ओके, तो किसको बचाना है? माँ को बचाना है, बच्चे को बचाना है. फिर वो क्या होता है उसमें, लविंग हस्बैंड बोलता है सर वाइफ को बचा लो, खड़ूस सास बोलते हैं डॉक्टर बहू को मरने दो, बच्चे को बचा. किसको बचाना है? ओके, साइड में डॉक्टर बैठा होता है, इंडियन गवर्नमेंट बोलता है सेव द टाइगर, सेव द लायन, सेव द चीता. डॉक्टर बोलते हैं पापा सेव द एफएमजी स्टूडेंट, सेव द नीट पीजी स्टूडेंट, सेव द डॉक्टर. ओके, सो प्लीज अंडरस्टैंड दिस कि mother is always first, and remember, when it is impending eclampsia or eclampsia, delivery is the definitive treatment. Delivery is the definitive treatment. Delivery करना ही पड़ेगा. Let it be 31 weeks. Yes sir, no problem. Because sir, patient 31 weeks है तो क्या हुआ? No, please understand this. Let the patient be 24 weeks, 26 weeks, 28 weeks, 32 weeks or 36 weeks. Answer will not change. You can't say, okay sir, we are 28 weeks, let me wait for 3-4 weeks and then I will deliver the patient so I can save the baby also. No, never wait and watch. If you wait and watch, we have to put you in jail. जेल में डालेंगे. क्यों जेल में डालेंगे? बिकॉज इफ यू वेट एंड वॉच, the mother will get convulsion, mother will die, baby will die. Okay, so I have to go and plan the delivery, and please write down in bracket, the delivery has to be done irrespective of weeks of gestation. Is this understood to all of you? Delivery has to be done irrespective of weeks of gestation. Okay, so let the question paper में but because sir it is impending eclampsia, convulsion can come anytime, we will be giving prophylactic magnesium sulfate. Do not forget this, most important. You have to save the mother, you have to protect the mother from convulsion. So your magnesium sulfate is given prophylactically, and then again after magnesium you cannot wait and watch. Okay, is this understood to all of you? So all of you look on the board. Labetalol and wait and watch, sorry. Okay, labetalol and LSCS at 34 weeks. Of course, labetalol will also be given. Magnesium sulfate you will give, and also you need to control the blood pressure. So labetalol also you will give. I'm not saying that, but delivery has to be done because delivery is the definitive treatment. Is this understood to all of you? And the delivery has to be done irrespective of weeks of gestation. इसके बाद 5 stars, put 5 stars around these words. Okay, so magnesium sulfate, labetalol, and then delivery at 37 weeks, jail, because we are only 31 weeks. Yes sir, magnesium sulfate, labetalol, and you immediately induce the labor. And yes, when I say delivery, we always induce the labor first, that is preferred. If not, don't directly do LSCS. LSCS can also be done, but if required. Okay, but first you try to do inducer. Okay, so induction of labor now only, immediately. Okay, so यहाँ पे let the patient be 31 weeks, 34 weeks, 35 weeks, answer will not change. Short question आने वाला है. Okay, Pritchard regime जो हम देते हैं magnesium sulfate. What are the 3 things do we monitor when the patient is on magnesium sulfate? So when the patient is on magnesium sulfate, we have to monitor the knee jerks or the deep tendon reflexes. We monitor the respiratory rate, and what we monitor, urine output. Please comment how much should be the urine. Yes, 4 to 7. 4 to 7 is the therapeutic range where the convulsion will stop at that target. 1 to 2 बहुत कम है, ये तो ज़्यादा toxicity हो गया. Okay, yes, so 4 to 7 urine output should be at least 25 to 30 cc per hour. 25 to 30 cc per hour, because we give every 4 hourly. So 100 ml 100 ml urine आना चाहिए 4 घंटे में. Okay, at least 100 ml in 4 hours. Is this understood to all of you? Very important. Yes, now again I want the diagnosis first. What is the diagnosis? Yes. So my dear student, whenever I have got a bleeding, this is a patient who has come to us with bleeding in the third trimester. Perfectly correct. Whenever I have got a patient when there is bleeding in the third trimester, T3. Two, and most important, only two things we have to keep in mind, and that is, sir, it could be placenta previa, where placenta is in front of the presenting part, or it could be abruption mainly. Okay, is it clear? Abruption is the most common cause of APH. Basically it is antepartum hemorrhage. The difference in the two most important, yes, placenta previa, sir, is a painless bleeding, and abruption is a painful bleeding you need to keep in mind. And what is the tone, sir? Here the uterus is relaxed, but sir, in abruption the uterine tone, yes, uterus tone is increased. Uterine tenderness, and therefore you can get the word tonically contracted uterus. Okay, and placenta previa, I can wait and watch. I can give tocolysis. Abruption, remember, never wait and watch, never give tocolysis. Abruption, you need to do the delivery as soon as possible. Okay, abruption, remember, deliver as soon as possible. Placenta previa, we can wait and watch. Is this understood to all of you? Yeah, thank you, Pratik. Thank you. Okay, thank you very much. Okay, yes. Okay, yes. So here, sir, very simple, and placenta previa, the blood pressure is initially normal. Abruption is associated with hypertension and preeclampsia. So I've got a patient who has come to us with painless bleeding and uterus is relaxed. That itself is the clue given to you that this is placenta previa. Eclampsia will give you history of convulsion. Abruption may uterus, and abruption generally associate hypertension. Okay, preeclampsia, hypertension history could be there. Okay, generally history hota hai. Okay, history of hypertension, preeclampsia, because that's a very common cause of abruption. Okay, and as I told you, painful bleeding hoga. Yes, is it clear to all of you? So don't keep in mind. Of course, after a lot of bleeding, BP come hoga, abruption may be, but to begin with, BP could be. So your BP is normal, and head is floating because the placenta prevents the baby's head from going down. Okay, the head is floating or unhinged because this is the uterus and this is the placenta over here. Okay, this is a placenta over here. So this is the baby, and therefore baby ka head is floating or unengaged. And placenta previa mein, how will I do the delivery? Please understand this. Fata placenta nikla heroine, not possible. Baby cannot perforate to the placenta and come out. So never induce labor. If you induce labor, jail. If you make the uterus contract, what will happen? There's going to be torrential bleeding. Patient will bleed to death. So in placenta previa, याद रखना है कि sir, I have to always go and do a cesarean section. Delivery is always by LSCS. But when, वो आपको देखना है. So tell me the answer. Evening time. Evening is the best. 6 to 9 evening time class रखने वाला है शाम को. And recordings will be there. Don't worry. Okay, Dr. Idiopathic. Recordings will be there. Don't worry. If you cannot attend live recordings, we are going to keep it till the date of the exam. Okay. 2 दिन लाइव क्लास है. लेक्चर्स के बाद रिकॉर्डिंग रहने वाला है till the date of your exam. Don't worry. Okay, so you can revise anytime afterwards also. Yes. Now again, इसने डायरेक्टली बोल दिया सिजेरियन सेक्शन रॉन्ग. रॉन्ग क्यों है? क्योंकि yes sir, this is painless bleeding, this is head floating, uterus relaxed, baby heart rate normal, very good, BP normal. So this is placenta previa. But what are you all missing? Yes, sir, we are 33 weeks. So, sir, placenta previa में induction of labor तो जेल है, forceps possible है, common sense है. Placenta यहाँ पे, forceps कैसे लगेगा? Forceps को भी जेल. Induction of labor जेल में डालो. Forceps को भी जेल में डालो. Okay? But placenta previa you can wait and watch, जिसको बोलते हैं what? MJ, McAfee and Johnson regime, MJ regime. यहाँ पे where we can wait and watch or conservative management in placenta previa, you will admit the patient, give her steroids. Yes, you will give her steroids for the baby lung maturity. You will closely observe the patient, wait and watch, bed rest, and don't go to the room and sleep. Closely observe the patient and monitor, and we can wait and watch. But why? Yes. Why wait and watch? So please understand this, that point number one, mother should be stable, isn't it? If the mother is not stable or mother is in shock, then wait and watch for what? For the mother to die. Then don't wait and watch. Is it clear? So अगर आपको दिया mother is in shock, if they tell you mother is in shock, then don't wait and watch. Then immediately give mother IV fluids. Of course, stabilize the mother, start blood, and then immediate LSCS करना है. Understood? If the mother is in shock with placenta previa का bleeding, we are talking of placenta previa. ठीक है? Second thing, there should be no fetal distress. Obviously, if there's fetal distress, then you don't wait. Okay. And lastly, pregnancy should be less than 36-37 weeks, and therefore all the three criteria, and therefore wait and watch is the answer. Yes. Okay. Is this understood? So now you look at the patient. Mother is stable. How I know? Hemoglobin 11, very good. BP 120/70, normal. So sir, mother is stable. Fetal heart rate 140, normal. And we are 33 weeks, and therefore wait and watch is the answer. Is this understood to all of you? If I make this heart rate 140, if I change the heart rate, and if I say, sir, fetal heart rate is dropping down to 90 per minute, what will be your answer? Then we are going to do cesarean section. Is this understood to all of you? Because sir, fetal heart rate 90 per minute is your fetal distress. Okay, so एक word change हो जाएगा, answer change हो जाएगा. Is this understood to all of you? So right now sir, we are 33 weeks with patient stable and mother plus baby are stable, and therefore wait and watch is the answer. Crystal clear? Yes. Very good. Thoko tali. Okay. Clear. Very simple MCQ. What is the diagnosis? Yes. So this is a simple case of postpartum hemorrhage, and that also atonic postpartum hemorrhage. एंड बच्चे लोग ध्यान से सुनो, अरे अरे एक्सेप्ट पूछा है, एक्सेप्ट नहीं पढ़ा क्लीन बोल्ड. ओके बेटा, साइक्लोन यंगस्टर, ध्रुव विशाल, दांडी गुल, क्लीन बोल्ड. Okay, so uterus is large and flabby, so it is a simple atonic PPH. Oxytocin though is the first drug of choice. Of course you give, we can give methergin also, we can give misoprostol also. And what is this carbetocin, newer drug, exam में मुझे याद कर लेना. Mifepristone, mifepristone has no role, mifepristone I told is for MTP. Okay, carbetocin is the drug which is like oxytocin, but it is stable at room temperature. It's a newer drug which you need to keep in mind. It's a newer drug which is stable at room temperature. Is this understood to all of you? Okay. हाँ एक्सेप्ट नहीं पढ़ा ये सुरभि मिश्रा डोंट वरी सो एग्जाम में याद रखना है ओके एग्जाम में याद रखना है ऑल ऑफ द फॉलोइंग ऑल जब भी आएगा ना ऑल ऑफ द फॉलोइंग तभी याद रखना नीचे के पूरा एंड पढ़ना है ओके yes very good okay so mifi has got no role other drugs we can use okay yes what is the diagnosis over here what is the diagnosis over here Yes. So please understand this. Whenever there is 2 months amenorrhea, uterus is empty. Uterus empty is a clue given to you. Okay. Very good. But can you make your diagnosis better? Can all of you make the diagnosis better? So sir, uterus के अंदर कुछ भी नहीं दिख रहा है. Uterus is empty. And whatever left right side whichever we are seeing some mass we are seeing a mass okay yes very good but all of you ectopic pregnancy unruptured ectopic pregnancy. Why am I saying unruptured ectopic pregnancy? There is a 2.5 by 3 centimeter mass. HCG. Look at the mother. Pulse normal. BP normal. Hemoglobin normal. So patient is stable and patient is not in shock. Stable patient. Unruptured ectopic. What do you do? Then what else? What else? Yes, when the gestational sac is less than 4 centimeter, which is our criteria mass of 2.5 by 3 centimeter. Okay, multiply नहीं करना है, वो भी याद रखो. 2.5 into 3 मतलब it is less than 4 centimeter. हाँ, the mass is less than 4 centimeter. Keep in mind. Very good. Yes. Those who, how many want to repeat USG after 2 weeks? Jail. Because in that 2 weeks ectopic will rupture. Similarly, sir, surgery is not required. Injection methotrexate is the most suitable because it is unruptured ectopic. And what should be the HCG criteria? HCG less than 5000 micro international units per ml. Crystal clear to all of you? Is this crystal clear to all of you? We are coming to that also. Okay, is it clear? So stable unruptured ectopic pregnancy, patient stable, gestation lag less than 4 centimeter and beta is less than 5k. ये 3 criteria याद रखेंगे. In such cases, then we always prefer methotrexate. After giving methotrexate, what do we do? Anybody? After giving methotrexate, what do we do? After giving methotrexate, sir, you have to monitor what? Of course, you need to tell the patient that any signs of rupture and monitor the HCG levels, and HCG should keep on going down. Is it understood? Yes, very good. Follow-up has to be done and you have to explain the patient about the signs and symptoms of ruptured ectopic. You may also repeat HCG, but that all is not important. Maximum 3 doses. Okay. And can anybody tell me इसी में और एक MCQ, one more MCQ? Okay, sir, this is the mass. Okay, this uterus is empty. So whenever there's a uterus empty and you have a sac-like structure outside the uterus, think of ectopic. Okay, and the patient is positive. Okay, beta HCG positive. Is it clear to all of you? Now here, no, beta cyclo, that is different. वो चेक फॉर डबलिंग एंड और ट्रिपलिंग नहीं करना है. यहाँ पे आफ्टर गिविंग मीथोट्रेक्स ड्रॉप डाउन. साइक्लोन, रॉन्ग कॉन्सेप्ट. Okay, cyclone youngster. That doubling and tripling you check when there's a confusion whether it's a intrauterine or extrauterine. Okay, uterus empty, HCG positive, think of ectopic. And over here, suppose if I do color Doppler, anybody ये क्या है? One more MCQ. अगर color Doppler करते हैं तो ये क्या हमको मिलेगा? What am I drawing? Yes, ring of fire, ring of fire. MCA Doppler नहीं बेटा, MCA is for IUGR बेटा. Okay, ring of fire appearance. Ectopic when the first trimester. Very good, Jimit. Okay, ring of fire. It's suggestive. It's not confirmatory. It's suggestive of suggestive. Okay. Excellent, all of you. Ring of fire appearance. Okay, is this understood to all of you? Yes. Moving on to the MCQ. Most common anomaly in the baby of the diabetic mother. Most common anomaly. हाँ पीडीएफ देंगे ना बेटा, पीडीएफ देंगे अंजलि, ऑफ कोर्स. यस, सो अगेन ए इज रॉन्ग. यस, प्लीज अंडरस्टैंड दिस. दैट सर द मोस्ट कॉमन पूछा है. sacral agenesis, also called as caudal regression syndrome, is the most specific. It is not the most common. It is the most specific anomaly. Yes, and VST is the most common. Okay. Now one more very difficult MCQ. All of you know, please keep this in mind. Okay. So when they ask you the most common is cardiovascular number 1, जिसमें होता है VSD. By the way, TGV is also there. TGV is a very classical cardiac anomaly. Okay. And next you get neural tube defect like anencephaly spina bifida. Okay. नहीं अंजलि, वीडियो स्टक नहीं हो रहा है, वन साइड से ऑल परफेक्ट है. यू कैन जस्ट लॉग आउट एंड लॉग इन, कम बैक इन. Okay, yes, very good. So neural tube defect is the second most common. So when they ask you about the most common anomaly, number 1 पे है CVS में है VSD, that's the answer. And neural tube defect anencephaly spina bifida, second most common. Is it clear to all of you? Transposition of great vessel is the very, okay, it is a very specific cardiac anomaly. Okay, so please don't make a mistake. Please don't make a mistake. You have to read the question correctly. The most specific cardiac anomaly पूछा है, then you mark transposition of great artery or transposition of great vessel. Is this understood to all of you? Understood to all of you? Okay, so please keep this in mind. Okay, and caudal regression is overall the most specific anomaly. Okay, crystal clear to all of you. Now PG level absolutely फाड़ू MCQ, tough MCQ. All of you my dear students know कि हमको दो टाइप का डायबिटीज होता है. When you say diabetes in pregnancy, there are two types. One is overt diabetes. Okay, overt. And second is gestational diabetes. Is this understood to all of you? ये सबको पता है. Okay, now can you tell me all this anomaly, ये जो anomaly होता है, is with both which one? Anomaly in the baby. Anybody? Yes, please understand this. That sir, both can have big baby, macrosomy, polyhydramnios, over distended uterus, ये दोनों में होगा. Okay, macros ये सब common है. Okay, Like if you see macrosomy, polyhydramnios, because of macrosomy, there is over distended uterus. So because of macrosomy, risk of shoulder, I'm writing SD, shoulder dystocia, risk of preterm labor, okay, and after delivery, even risk of PPH and even sudden IUFD. Okay, दोनों में नहीं मिलेगा. Yes, clean bold, medico. Okay, yes. Okay, so remember this, these are common. So what are the complications of macrosomy, polyhydramnios, shoulder dystocia, SD is shoulder dystocia. Preterm labor, PPH. That is only that is with both. But my dear student, gestational diabetes develops only at 24 to 28 weeks most of the time. It enters the picture at around 24 to 28 weeks and बाद में patient can develop gestational diabetes. In gestational diabetes, in the first trimester, the sugars are normal. In the first trimester, the sugars are normal. Is this understood? And when over diabetes when it is uncontrolled, that is the time there is anomaly. Clap if you have learned something new. Thoko tali. Okay, so remember this, anomaly is only seen in your over diabetes. There is a risk of anomaly with uncontrolled overt diabetes in the first trimester when the sugars are very high, and यहाँ पे in gestational diabetes there is no risk of any anomaly in the baby. Is this understood to all of you? So anomaly in diabetic mother is only in overt diabetes and never in gestational. Clap. Is it understood all of you? All are part of AMCEL's criteria again except mat bhulna. So share this video with all your friends and colleagues. Download the OG Guru app also and feel to WhatsApp me on this number for any help and guidance which you require. I'm always there to help you out. And grayish white discharge होता है. Positive whiff test भी होता है. Presence of clue cells is also there. Yes, only one sign. Vaginal pH is more than 4.7. Okay, acidic pH is in favor of candidiasis. Okay, candidiasis में यहाँ पे grayish white discharge होता है. So all except your pH less than 4.7. Okay. Is this understood to all of you? And what is the type of discharge what you get? What is the type of discharge? ये भी बहुत important है. Discharge what you get in candidiasis. Candidiasis में and trichomoniasis में. Okay, because here I told you anybody यहाँ पे है grayish white discharge. Yeah, fishy odor, very good. So candidiasis में cheesy white, पनीरी white. Okay, cottage cheese white. Cottage cheese मतलब पनीर. So शाही पनीर, बटर पनीर मसाला, शाही कुरमा. Okay, cheesy white. Okay, या cottage cheese white. Milky white, yes, curdy white, very good. Curdy white, milky white, cheesy white, lassi white, vanilla white, all that white is all dairy products. Okay, clear. And trichomoniasis में कौन सा होता है discharge? Greenish yellow. तो ये भी मार्क करना है, ये भी याद रखना है. And do not forget this. In trichomoniasis, if this is the cervix और ऐसा डॉट 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 डॉट, तो trichomoniasis में strawberry cervix. Do not forget this. Yeah, whenever you will eat paneer or cheese, you will remember me. Yes. Okay. So strawberry cervix are punctate hemorrhages this also you keep in mind. You will get this punctate hemorrhages in the strawberry cervix or strawberry vagina. You get hemorrhages, punctate hemorrhages. Yes, very important. Chalo. Now here somebody was telling me, yes, now here what is the diagnosis? Patient has come to us with emergency in the first trimester. Okay, shock in early pregnancy. क्या है dictum? Okay, so क्या याद रखना है all of you? What you need to keep in mind is shock in early pregnancy. Please remember the rule. Shock in early pregnancy is because of ruptured ectopic pregnancy. Unless proven otherwise. Yes. Beta, both. No. Concealed abruption will lead to covulier. Okay. What is the meaning of this, sir? Whenever a patient has come to us with shock in early pregnancy, we have to always think of ruptured ectopic first. Okay, that is the meaning. Ruptured ectopic unless proven otherwise. Is it clear to all of you? Unless proven otherwise का मतलब समझ में आ गया कि sir, whenever I have got the patient who has this, unless I prove it otherwise, कि कुछ और रीजन है, I have to always think of ruptured ectopic unless it is proven rupture. Yes. Okay, is it clear? So here we have got a 20-year-old who is coming to the emergency ward with 2 months amenorrhea. So she's in the first trimester. Of course, she's in shock and pain with BP 90/60, hemoglobin 6, and urine test is positive. So she is pregnancy ka first trimester. And therefore, what is our diagnosis? सर डायग्नोसिस इज रप्चर्ड एक्टोपिक प्रेगनेंसी. यहाँ पे जिसको मीथोट्रेक्सेट मार्क करना है, जेल. रप्चर्ड एक्टोपिक में यू कांट गिव मीथोट्रेक्सेट. समझा बच्चा लोग? सो दैट इज व्हाई हाउ बोथ क्वेश्चंस आई एम डिस्कसिंग. ओके, here ruptured ectopic में if you give me, okay, and very good. So whenever you have ruptured ectopic, remember this one is the general management. General management is very important. What you do? 2 wide bore IV lines. Very good. Okay, 2 wide bore IV lines, IV fluids cross match. Okay, 2 wide bore IV lines you will put, collect blood for cross match. Okay, IV fluids you start, and also even start blood transfusion also, and then shift to the operation theater and immediate surgery. Okay, surgery. And surgery में हम क्या करते हैं? Okay, remember this. You have to quickly enter the abdomen. It's a ruptured ectopic pregnancy. Okay, ruptured ectopic. तो क्या करना होता है sir? This is the uterus. You will quickly enter the abdomen. You will see कि sir one side tube is normal. You will see the normal tube. And sir, suppose this is the tube which has stone. Okay, this is the tube which has stone, and therefore there's torrential bleeding. There's torrential bleeding. There's all blood in the pelvis. All blood है पूरे pelvis में. Okay, so till the time you clamp the tube and you remove the tube, the bleeding is not going to come up. Bleeding is not going to stop. Is it clear to all of you? So to quickly clamp the tube and get this tube out, and salpingectomy is the gold standard surgery. Please don't feel sad that you are cutting off patient's tube. One tube is enough to cause population explosion. So salpingectomy is the gold standard surgery. You quickly cut this tube out. See the other tube is normal. Remove all the blood clots and quickly come out. क्या याद रखना है? Dictum. ये भी virgin MCQ. Quick in, quick out. ये पूछेंगे एग्जाम में. Quick in, quick out. किसके लिए? फटाक से enter the abdomen. Quickly get the tube out. Quickly come out. बेटा हाँ, मुरलीधरन दूसरा ट्यूब है. 1 ट्यूब इज इनफ. ओके, पेशेंट को जान बचेगा तो कंसीव होगा. 1 ट्यूब इज नॉर्मल. शी कैन कंसीव 10 times. Okay, 1 tube is enough for the cricket team. Very good. And today IVF is also there. Suppose both the tubes are gone, IVF is there. Okay, is it clear to all of you? So laparoscopy, weight put on when the patient is in shock. when the patient is in shock. And ये salpingotomy is all कचरा dustbin. Ruptured ectopic में salpingotomy नहीं कर सकते हैं. Salpingectomy is the gold standard surgery and you will do it. That is the answer. Is this understood to all of you? One tube is enough, so don't panic. Your life saving is important. Patient has come to you in shock. Salpingectomy is the gold standard surgery for ruptured ectopic pregnancy. Is this understood to all of you? And this is so surgery, and I told you, I explained to you what the surgery to be done. Okay, immediately you go in for surgery. That is the definitive management. Okay, and this is again absolutely concept based question. These are the various conditions and what are the various investigations which will help you out, and this is again a very important match the column kind of a condition. Is this understood to all of you? Yes. Okay, so all of you please pay attention now. Asherman syndrome is what? Asherman syndrome is what? Yes sir, Asherman syndrome is intrauterine adhesions, not the adhesions between the tube and the, it is the intrauterine adhesions. I told you Asherman syndrome के लिए we require hysteroscopy. आशरमैन सिंड्रोम के लिए करना है हिस्टेरोस्कोपी 2A. 2A, दो ऑप्शन रूल आउट हो गया. ऐसे करके मैच द कॉलम सॉल्व करेगा. एंडोमेट्रियोसिस के लिए लैप्रोस्कोपी. व्हाट डू यू सी सर? व्हेन आई पुट इन अ टेलीस्कोप विल सी द चॉकलेट सिस्ट. You will see all the red color, blue color spots. Okay, so endometriosis requires laparoscopy 1B. 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 दो ऑप्शन हमारे पास. अब तो अभी दो चल रहा है. 1B 2A 1B 2A. क्लियर कट. ये अभी दो आउट हो गया है. 1A नहीं है. ओके, 1A नहीं है. क्लियर. तो दो आउट है. ओके, एंडोमेट्रियोसिस में कैन यू टेल मी व्हाट ऑल विल आई सी व्हेन आई डू लैप्रोस्कोपी? ओके, so sir, in laparoscopy we put in a telescope through the anterior abdominal wall. That is the terrace view laparoscopy mein. And sir, in a patient of endometriosis we can see what? Sir, we can see a chocolate cyst. And और क्या दिखेगा? चलो tell me. Fruit salad. Yes, why fruit salad? So you'll get blue nodules. blue color, blueberry nodule. फिर red color, red raspberry, red strawberry and gunshot, matchstick burn spots. तो ये सब हमको laparoscopy पे ही दिखेगा. Laparoscopy is the investigation of choice and gold standard to take the biopsy. Histopathology is confirmatory. Okay, there will be adhesions in the pouch of Douglas. All adhesions would be there. And of course, do not forget to write about the chocolate cyst also. Brownish color का chocolate cyst. Okay, chocolate cyst. तो ये सब आपको laparoscopy में ही दिखेगा. Okay, this is laparoscopy picture of endometriosis. Don't forget this. Okay, and therefore you have got in endometriosis 1B. Now whenever there is a torsion, what happens in torsion? So the pedicle will get twisted, the ovary will get twisted, and therefore for torsion, color Doppler 3C. Very good, 3C. And for fibroids, normally ultrasonography is okay. Why torsion? Severe, remember, acute abdomen vomiting. Color Doppler is most important for torsion, because when there is a twist in the pedicle, the blood flow will get occluded. Okay, the blood flow will be absent. Absent blood flow is suggestive of torsion, and therefore very good. 3D नहीं है and ये नहीं है. Very good. C is the answer. Perfectly correct. Normal fibroids के लिए USG is okay. So yes, color Doppler is also USG, but specifically for torsion, remember, for torsion, color Doppler is the investigation of choice, and therefore C becomes the answer. Yes, all of you correct. Superb. Is this understood to all of you? Because sir, whenever there's a torsion, the blood supply will get occluded. and that will cause that can cause gangrene and necrosis. To do immediate surgery is what you need to do. Is this understood to all of you? Yes, thank you. If you're clapped, you have something new. Okay, and that is all of you. Look at the beautiful handwritten notes easily in 2 hours. Completely color notes, completely handwritten notes. Once you see the video lectures, only in 2 hours you can revise the entire notes. And as I said, students reviews you can see on your end. And do not, please share this video with all your friends and colleagues, and do not forget to follow me on Insta and YouTube. Okay, okay, so this is what you message me. Okay, and the PDF will be available on Telegram. So 2 things, last thing student, do not panic. It is natural to feel stressed up. एग्जाम के नज़दीक स्ट्रेस अप होना नॉर्मल है. ऐसा लगेगा कि सर हम भूल रहे हैं. ग्रैंड टेस्ट के स्कोर को ज़्यादा पैनिक मत करना. ग्रैंड टेस्ट में बहुत सारे स्टूडेंट्स 145 140 पे अटक रहे हैं. दे फील कि सर कुछ भी नहीं आ रहा. ऐसा नहीं है. ग्रैंड टेस्ट थोड़ा कभी कभी ज़्यादा एक्स्ट्रा टफ भी होता है. ओके, बट आपके ग्रैंड टेस्ट का एनालिसिस करना है. वेयर यू आर मेकिंग मिस्टेक्स यू नीड टू फाइंड आउट सो दैट यू डोंट मिस्टेक एंड रीड द मोस्ट इंपॉर्टेंट भाई एडवाइस टू ऑल द स्टूडेंट इज कीप काम, कीप रिलैक्स्ड एंड रीड द क्वेश्चन करेक्टली. ये ही मुझे आप लोगों को मोस्ट इंपॉर्टेंट मैसेज है. पॉजिटिविटी, meditate and think positive, and once your results are out you will obviously get in touch with me. All of you will do very well and your OBGY score tremendously is my guarantee. बहुत सारा हम cover करेंगे. If this 2-hour session has given you lot of information, imagine when you listen to me for 6 hours, easily 10-15 marks boost up होने वाला है, and that can help you clear 150 barrier for sure. So that's wishing. Okay, that's there's wishing you best of luck, wishing you all the happy new year and very successful. All of you will clear. Just don't panic, keep cool, keep calm, read the question correctly and follow me on Insta and YouTube, and we will be there to help you out and guide you. Bye bye, best of luck, thank you very much, and that's my time. See you all of you and wishing you all the best for the upcoming FMG examination. Okay, and as I said, this session is only specifically for this FMG. All those who are giving next year FMG is masterclass available in the app. So all those who are for next FMG examination should be taking the masterclass 6 months package or 12 months package. So tell all your friends and colleagues also about my app and make them enroll also for the upcoming examination. Bye bye, best of luck, thank you very much. Yes, I'll upload the PDF also.